Do you have loose skin of your upper arms? Well, if you do, then this video will explain to you all your various options to treat it. Now, loose skin of the upper arms typically occurs due to one of two issues. Either you have got aging skin, so people have loose skin as they get older, or you've had weight loss. And the people who have the most excess skin is typically due to a combination of both. They've had weight loss and they're maybe a little bit older. So as we get older, that skin can droop. And also, once again, with weight loss, you can get excess skin. Now, if the issue is not so much loose arm skin, but it is excess fat, especially if you're younger and you haven't lost weight, then instead of going over this consultation video, I would encourage you to go to the area that is rest of the body surgery and excess fat. So in this section, go to the area where your issue is excess fat. Now I'll explain to you how we can liposuction the fat from your upper arms. But if your main issue is not fat, but it is loose skin, even if there is some fat with it, then why don't we continue on and I can give you information about your various options. And the option basically is one. It is brachioplasty. So there are really two procedures that we can do surgically for the upper arms. We can liposuction if you've got good skin and just some excess fat, then liposuction can be a very reasonable option. It's typically a small incision at the elbow and we can suck that fat out. And once again, go to that section of unwanted fat, excess fat, on this pre-consultation course, and I'll go over all the details of the liposuction with you. But if the issue is more skin and looseness and hanging skin, then the brachioplasty is what you want to consider. Now, during the brachioplasty, what I basically do is liposuction the upper arm and remove the excess skin. Now, the surgery is done under a general anesthetic, so you're completely asleep. While you're asleep, we prep both of your arms, and I make a little incision at the base around the elbow. And then I will inject anesthetic solution into the fat of the posterior compartment, which is the back of your upper arm. I give it a few minutes, and then I liposuction the upper arm of the excess fat. And then I make an incision basically from your armpit all the way to your elbow. And making that incision, it allows me to cut out the excess skin. So that excess skin is removed, and the long incision basically from your armpit to your elbow is then sutured closed. There's typically a drainage tube that stays in place for up to a couple days. We will wrap your arms and put them in a special type of compression garment, and then you head over to the recovery room. Now in the recovery room, you'll stay there for about a half hour to an hour. We'll keep your arms a bit elevated at that time, and then you head on home. You come to see us after a couple of days so we can take your drainage tube out. And in the meantime, in the first couple of days, you'll probably take some pain pills initially to make sure that you're comfortable. You keep the arms elevated, and you hold off on showering basically the arm areas. You can shower from the chest down basically, that's okay, until we take the drainage tube out. So once again, the drainage tube usually comes out after just a couple of days, and then we take a look at everything and have you continue to wear the compression garment over your arms, really for the first few weeks. Typically, you'll see a result right away. You're going to notice that the arms are definitely smaller, although you will be swollen. You avoid exercising for about 3 weeks, and then when you start exercising at 3 weeks, we'll have you start with the lower body first because your arms are going to still be a little bit sore. Eventually, you'll be able to get to complete normal activity with your arms, but that can take a good 6 to 8 weeks to completely get there. And the swelling can take a total of 4 to 6 months. The scars, however, can take longer. They can take up to a year to heal, and those scars will never disappear. So one thing I tell patients is if you have a brachioplasty, it doesn't mean that you'll feel comfortable wearing a short sleeve shirt. You will have a scar on the inside of the upper arm. And so if you lift your hand up and you wave to somebody and you've got a short sleeve shirt on, they might see that scar in your upper arm. Okay, so keep that in mind. There is this definite trade-off. That scar typically heals well. You give it 6 months to a year, but there's always a risk of thickening of the scar and darkening the scar, especially in people who have darker skin. And that scar can also potentially widen. The recovery usually isn't that bad. You just don't use your arms a lot for a couple of weeks, but eventually you get back to completely normal activity. So what are the risks with brachioplasty surgery? Well, like anything, there's always a risk of bleeding and infection. There's a risk of thick scarring, of wide scarring, of keloids, visible scarring. That's always possible, and I always warn patients about that beforehand. There's risks that you can have excess swelling, and that can disrupt the potential blood supply to your hand. And so that's something that we watch very closely and is almost never a real concern, but something that we watch closely for. The upper arm also has a lot of blood vessels and nerves there that technically could be at risk at the time of surgery, so I'm very, very careful not to damage anything. And typically, once again, people do really well. And we'll talk more about the potential risks and complications at the time of a face-to-face consultation and or at the preoperative appointment. Now, this is a patient that you can see who had a brachioplasty surgery. And if you look at the picture of the after, you can see that scar extending from her armpit all the way to the elbow, but a nice improvement in that loose skin of her upper arms. And here's the other side for you. You can really see that skin hanging on the before picture and how things look so much better on her after photo. So if you've got issues with excess skin and loose skin of your upper arms, the treatment is a brachioplasty. There's no real other option. If you're wondering if you can shorten scar this and keep the scar just in the armpit, it doesn't work, unfortunately. You have to just go through the whole thing. So your options really for upper arm surgery cosmetically would be a brachioplasty, which once again we use if you've got a lot of loose skin, or liposuction. And if you have tight skin with just some fat, then take a peek at that area for liposuction on the excess fat, unwanted fat area of this pre-consultation video course. Thank you so much for watching.